Good morning. Thanks very much for the invitation. I'm really delighted to be with you today and to share with you some of the recent developments in terms of the epidemiological situation around non-communicable diseases, particularly in the older population and with the focus on the European region of the WHO European region. I also take the opportunity to express our gratitude to the organizers for this invitation. And I hope you enjoyed the presentation. I'm mainly going to focus really on relatively recent data and what are the main challenges that we are really facing in terms of non-communicable diseases in the region, in this specific group, and I will try not to take more than the allocated time. As you can see on the second slide, really the non-communicable diseases are the major cause of death for older adults in our region, and they account for approximately 2/3 of all deaths. And really, we are specifically talking about the age group over 70 years old. As you can see, again, in the slide, one can notice how really important NCDs become proportionately over time, and they are, of course, the major killer and major cause of death and disability and number of years lived without quality of life, if you will, in the WHO European region. So to really ensure that the older people among us really benefit from well-being and a better life, we really cannot avoid addressing and tackling non-communicable diseases. In slide number 3, you can really see that it's a different way of presenting data, but again, we are referring to the disease burden at this time, and we divided it by risk factors. This is, of course, data provided by the IHME, and one can see that really NCD and NCD-related risk factors, notably high blood pressure, which, as you know, is very much related with salt, not only, but salt intake is very important, diet-related risks, high sugar, glucose, high BMI, cholesterol, normalities. These are all among really the major causes of disease burden, and obviously in the population over 70, data estimated in 2017, and as you can see, largely it's very much related with non-communicable diseases. So whatever the metrics, the calculations, one cannot avoid to really acknowledge that non-communicable diseases are absolutely critical in this context. And here, a different way of presenting different risk factors for non-communicable diseases. And again, we're focusing on the share of the population over 70 years old and over, which is, of course, bigger and bigger share of the population in many European countries, particularly in Western European countries. As I said in the previous slide, this slide number 4, you see that, again, high systolic blood pressure it's really very important, number 1 factor. Dietary risk factors, again, tremendously important. And as we move and we look at older fringes of the population, you really see that NCD-related risk factors, one could say that they are becoming more and more important. So one has really to deal with them. It's almost impossible to have good quality of life, to extend life, which is a major priority in many WHO European region in terms of their development and health policies investments, really important priority. But not only extending life, increasing life expectancy, but also making sure that the last years of life are really lived with the best quality possible. And here with this set of slides, one can see that really non-communicable diseases are sort of impairing us from achieving this full potential to live the last, let's say, quarter of our lives with bigger quality. And that's really very, very important. And one has to address non-communicable diseases properly if we are about to solve these issues. In a nutshell, next slide is really about these NCD risk factors among older adults in Europe, in the WHO European region, or in parts of the WHO European region. If one could give you the example of the EU, actually almost every 2 out of 10 EU citizens over 65-year-old really account for, we have an expected, cost increase in terms of health-related costs, and it's not just about individual quality of life, but it's also about how can we really deal with the challenges and the pressure on health systems, particularly in difficult times. And one cannot really stop from addressing non-communicable diseases, but those, because of the challenges that they entail, because of the technologies that it's, secondary and tertiary prevention particularly really require, they are many times related with higher costs. Needless to say that diabetes, obesity, cardiovascular diseases, and cancer are really more important, and in older people, as we, of course, said before. We also noticed that cheap, really very effective interventions are not used to the full extent in number of European region countries. One of them is obviously physical activity. We don't use physical activity programs and the promotion of physical activity in the elderly population as much as we should or could be used. And this is, as I said, a very low-cost intervention with excellent return on investment. As simple as one can say that physical activity, increasing physical activity programs have shown to be able, for example, to increase or to reduce falls in about almost 20%. That's a massive impact. And also, addressing mobility issues, which, as we all know, are some of the biggest challenges in the elderly population. Actually, in some countries, particularly EU countries, 1 out of 3 older citizens reports that over citizens over 75, they report that they have severe difficulties, notably in walking. So, these are important, not just life-threatening, but quality of life reducing elements that could be really addressed in the older population if we have the proper programs in place. There are great examples of success, but potentially more can be done to address this challenging data. We also know that the elder and the older groups of our population have more difficulties for several reasons in adopting a healthy lifestyle that includes physical activity. And it's really very important to understand that this affects more than 4 out of 10 adults over 50, but as we grow older, the number of the percentage, the proportion of the population that does not achieve minimum levels, the needed, the WHO recommendations in terms of physical activity become lower and lower. And this is more prominent, for example, in the groups of the population with lower income and lower levels of education. So there's really a massive issue in terms of inequalities, also in terms of NCDs and their prominence in the older population. In the next slide, just another small illustration in terms of on how really preventable elements in terms of non-communicable diseases are very important. Some are going to address and have addressed in this conference the importance of health systems and the adequate health systems, technologies to really address NCD-related elements. I will focus more. My presentation is more focused on risk factors. If you look at this slide in terms of alcohol consumption, it's very striking that, of course, adults over 65, they drink less than average, but overall, in the European countries, almost 14 liters of pure alcohol per capita per year in this population is a massive intake. They should have really been reduced quite dramatically, and we haven't get there yet. So we are faced with really high prevalence of non-healthy behaviors related with NCD risk factors, of which physical inactivity, but also alcohol consumption, which is many times forgotten in the older population, is really very, very important. If you look at, again, even heavy episodic drinking, which is more common in the younger groups of the population, still we have, as you can see in the slide, something like 1 out of 10 of individuals over 65 that engage in episodics of heavy drinking, which, as you know, correspond to something like 60 grams of alcohol in a single occasion, which is, a huge amount of alcohol, almost just below 2 liters of beer, and a very significant amount of wine and other drinks as well. So we're talking about the last month, in the last 30 days. So 1 in 10 over 65 really having episodic drinks, which heavy episodic drinking, which for example is very highly correlated with certain types of stroke, and therefore we really need to pay more attention to this. Needless to say, we have identified a correlation between alcohol consumption and dementia, for example. So this issue is very important, and there is a very interesting study which I'm showing in this slide where almost 60% of early onset dementia is either related with alcohol-related brain damage or individual diagnosed with some type of alcohol, severe, high alcohol intake. So that's really interesting and important also to take into account when these type of disorders also become very important in these age groups. I would like also to remind us and take the opportunity in these COVID times that really the older group in the population is more at risk, as we all know, but also those who suffer non-communicable diseases, diabetes. Obesity has been identified as an independent risk factor in some of the groups. High blood pressure, certain cancer, but particularly diabetes is really extremely important. And we know that the prevalence of these diseases are really important in this age group. So maybe you would like to look at the paper that our regional director, Dr. Hans Klug, led and that we published recently in the Lancet. Again, for us, it's about promoting a life course approach that really brings generations together and that ensure that the older population is really supported, but it fulfills all their potential in terms of contribution to society and also with the interaction with other groups of our society. And of course, prevention starts very early, starts even before pregnancy. And of course, taking care of the older means that we also start very early from before pregnancy, early life, and all of that, and making sure that those who are more vulnerable are more protected. And our societies really need to do that. And certainly, in many instances, the elderly in the European societies, in the European region, could be better protected from non-communicable diseases. Basically, more prevention, better care are important. Taking an holistic approach. This is what I mean with this beautiful picture, I think, about, nice foods, vegetables, meaning that an holistic approach is very important. We need to look at the environment. The elder group is also exposed and more susceptible to the challenges placed nowadays by food insecurity, challenges around food systems, access to healthy foods in the neighborhoods, attention to food deserts and places where the most vulnerable among the older population do not have proper access to many of the things that many of us take for granted and that are essential, like really sustainable, healthy foods. In the European region, we have gone a long way, and one of the examples I would like to give you is that the one that really focus on, again, two of the main risk factors for non-communicable diseases, which specifically have a focus on the older groups among our populations. And obviously, I would like to remind you about the Food and Nutrition Action Plan, the European one, and the Physical Activity Strategy for the WHO European region. These are clearly two relatively recent strategies. The physical activity one runs until 2025. The food and nutrition one is going to be extended. Some elements not fully accomplished yet, and therefore member states in the European region decided that they want to pursue some of its objectives and will be expanding it, giving it a bit more time. And they clearly identify, not exclusively, there are also other strategies, action plans, roadmaps that do the same, but this one is really very, very important. And in a nutshell, basically in terms of the physical activity strategy, we have a life course approach, and we identify the different areas where the elderly population needs really to be more supported, because it's really very important not just to prevent non-communicable diseases, but for aspects of mobility, mental health, really well-being and quality of life. The risk factors are known when we don't achieve those levels of physical activity, and they've been described before, and I think it's never too much to remind us all, and that's what really I do in this next slide. So really promoting physical activity needs to be everywhere, and these programs need to be fully comprehensive, and that's really what the European strategy really tries to do, tries to provide clear advice, gives examples, and really puts the tone on really working with the most vulnerable group. But the fact is that looking at implementation and how far member states have gone in the European region, we realize there's still a long way to go. As you can see in this slide that is a summary of many of the policies in the region, almost half of the countries do not have schemes for physical activity promotion in the older adults. So although we've gone a long way, probably one of the regions that has moved faster and further in terms of the WHO, but a bit more needs to be done. In terms of healthy diet, basically the same. Diet is also a way to socially interact, and that's very important. There are nutrition needs, specific ones in the elder population that need to be accomplished. We have huge problems there in terms of frailty of the age population that spends time in hospitals, for example, but even those that are at home and that require to have healthier diets at home, we are not accomplished in full those healthy diets yet, and therefore we have big challenges in this area as well. So really making sure that the financial resources are there, that we have, that there is capacity to cook, to store, access to shops, appropriate cooking, being able to cook, having someone who can cook. The level of education is also absolutely critical here. So diet is also a way. Food and nutrition and physical activity, these are ways to avoid social exclusion, isolation, and really by coming together and supporting the elderly, we are able to really avoid levels of malnutrition that then can really exacerbate all the problems that the elderly already have and that are summarized in a way, in a nutshell, in this slide. One last, and as I finish, just one last minute to refer to, even among those who are in the older group of the population, there are some who are really critically more vulnerable. Therefore, I just include one or two slides in terms of those who are deprived from their liberty, from their freedom in places of detention. For example, in this slide, you have just an identification on one hand of the prevalence of, the older population in prisons, but also you have a summary of some of the facilities that already exist in these settings, meaning that more attention has been paid recently for this in terms of this context, but also important to acknowledge that the prisoners, normally their physiological age is almost about 10 years older than the normal population. So again, as a last point, we also need to pay specific attention to those in the older group of the population that are more vulnerable and in specific circumstances of our societies. And prisons is just an example. There are more, but I decided to bring this one because it's really important and is one area that is quite often forgotten, and where obviously all these non-communicable diseases that you see in this slide are still very, very prevalent. So I think I would stop here, wishing you all a great conference. I hope we can meet again in person soon. I am sure that we will overcome all these difficulties we've been facing together. And I think that the prevention of non-communicable diseases and addressing non-communicable diseases, particularly their risk factors in the older population, is really very important for us. And I think that altogether, in these difficult COVID times, we will be able to address it properly. Thank you very much. Have a nice day.